Welcome back to the 180 System video series, and today we're going to be talking about loading patients. So the typical patient that we see here already has some type of injury that they're coming in for rehabilitation. We do have patients that we see for tune-ups, either preseason with our athletes or mid-season, just to make sure everything is working correctly, so they come in for basically a tune-up. But the overwhelming majority of our patients are coming in with an injury. They also may be coming in post-surgical, post-car accident. So we see all kinds of patients and all kinds of age ranges from about 9-year-old athletes all the way up to 80, 90-year-old Medicare patients. So the question is, when should we and can we load these patients? So the quick answer to that question is yes. We want to load every patient that comes in as much as we possibly can. Now, of course, if we have somebody coming in with weight-bearing precautions after some kind of meniscal repair or something like that, obviously we're going to heed those precautions. But with the typical patient, we want to load because what we're trying to do is get muscles to contract normally in order to let them function normally. So loading a patient is going to increase all of the co-contraction throughout, let's say, the lower extremity. So if we've got somebody who has knee pain with body weight air squats, and we put them under a 25-pound load with either a kettlebell or a dumbbell, and they're able to squat pain-free, that tells us that if we get more muscles to kick in and more muscles to co-contract and facilitate, their motion begins to get better and they function normally. To take that a step further, we rarely ever give patients exercises in either supine, prone, or quadruped because that's not functionally loading them as they would be during their sports, their work, whatever their activities of daily living are. So we want to simulate ADL and sport-specific activity as much as we possibly can, and that's really hard to do without loading somebody. So just because somebody has pain without load doesn't mean we can't load them. After we treat them, their pain should be lower, their range of motion should be higher, strength and stability should be better, and we should be able to load them with something as simple as 10 to 15 pounds. With our athletes, we may be able to load them with 55, 65-pound kettlebells for goblet squats or something like that. But we always want to load our patients as much as we possibly can.